to this topic on improving the metabolic health in women with type 2 diabetes, and special emphasis over here is about the intermittent fasting which we do. We've been doing work for last 12 years, reversal of diabetes and metabolic disorders. As madam mentioned, I'm not going to go too much into the background, but we all know that fasting helps in terms of reducing the visceral fat, liver fat, and overall reversal. So we thought of studying the difference in the overall pattern of improvement versus those who have fasted. And we've devised a special way of fasting called as progressive intermittent fasting. And I'll speak a little bit about that as we move ahead. The sample size for this particular or presentation is 1,605 people. Eligibility is females because it's on women's health, more than 18 years and more than 23 BMI. These parameters were assessed and statistical analysis tools were used. Intervention is an elaborate one. It goes for 1 year on kind of taking them through different modes of the diet, plant-based, then fasting, then muscle building. Exercise also is graded over a period of time. A lot of work on stress release and positivity building. Both is done, and medically we take care of all of them completely. And the mode of delivery is at a one-to-one level, individual plans, and also group therapy. A lot of group sessions, learning sessions, wisdom sessions are taken through. So the main part in terms of what is this progressive intermittent fasting protocol. So after they've done 4 to 5 weeks of alkalizing the system, they start doing 3 meals, 2 meals alternately, ending with a juice feasting, which is vegetable juice feasting. Then go on 2 meals on the second week. Then try and see if they can do single meals on alternate days, and go on a single meal for the 4th week. And then there's a 48-hour fast, which is built into the system. So let's look at the results of what has happened. These are the baseline characteristics. 55 years is the age, around 10 years is the diabetes, 68 kg is the weight. Other parameters I'm not reading because then it'll be better for you to see with the change. Post-intervention overall outcomes, what has happened. So one is BMI has gone down from 27.7 to 25.6, HbA1c from 7.5 to 6.6, and similarly across lipid profile, HDL, ratios, BP, HSCRP, there has been improvement post the intervention. Now the interesting thing which we want to share is what has happened with respect to those who did fasting and who didn't do fasting. This is overall improvement for the entire group of 1,605 people. So those who did fasting pre-intervention, 92% of them were on medication. At the end, they were 51% on medication. Hypertension has come down by 6+%, and statins by around 16%. So this is overall for both the groups. Okay. Now we come to the fasting group. In fasting, we had 867 ladies doing the fast, 738 did not do the fast. Baseline for both is similar. Few parameters are maybe a little different, like weight and fasting insulin and BP, but you will see a change in both the groups. So first is remission rate. Remission rate significantly higher for the fasting group, 33%, versus the non-fasting group at 23%. Weight, obviously we would expect that the fasting group will undergo more weight loss, so it is there. 63 kgs they've come down to. Non-fasting is at 67 from 68. HbA1c also, fasting group has a lower HbA1c, 6.5 versus 6.7 for the non-fasting group. Fasting insulin, which is a key parameter of insulin resistance, also there's a statistical difference, 7.1 versus 7.5, and it correlates with the HOMA-IR of 2.1 versus 2.3. Lipid profile, interestingly, showed significantly higher improvement in triglycerides and HDL both, but total cholesterol and LDL for both the groups was similar. The ratios, triglycerides to HDL ratio, was better in the fasting group, and that was also statistically significant. Blood pressure, we had just 13% of them having blood pressure more than 140/90 versus 21% for the non-fasting group. So there was again statistical difference over here. And HSCRP showed similar improvement for both the groups. In fact, we found that for prolonged fast, many a times HSCRP can also increase after the fast temporarily. Then it settles down over a longer period of time. But here we couldn't find any big statistical difference. So conclusion is progressive intermittent fasting within a lifestyle intervention can actually improve the metabolic health marker in women much more than just a lifestyle intervention. And higher emission rates suggest that PIF is a potent complementary strategy. That's it from my end. Thank you very much for listening.